Have you ever wondered what it's like to have an ingrown toenail removed? In this video, I'm demonstrating how we perform what's known as a matrixectomy on this patient. A matrixectomy is when we permanently remove the ingrown toenail. And what we're doing is we're inserting a chemical called phenol, and that phenol will create a burn to the cells that grow the toenail. So sit back and watch as we perform this on this patient, and you can learn how a matrixectomy is performed in case you have to have one done. First, you can see we have put a green rubber band around this toe, and this is a tourniquet, and it actually will slow the bleeding down. The next step is to free up the offending nail border that's causing all this pain. And you can see in this particular example, this was on the inside or the medial border of this patient, and it wasn't an infectious process. It was more of a chronic incurvated or ingrown toenail. And the nail plate, as we call it, was curved and applying pressure to the nail fold. Now, some people will think that there are ways that you can uncurve this nail, and you actually can't. So what you'll do is just cut it and remove it. After we free it up, we use an instrument known as a nail nipper, which is basically nothing more than an instrument to cut toenails, and we'll create a small cut into the toe. And then you can see we use a chisel blade to actually perform a slice longitudinally along the nail plate. And I'm demonstrating that I use my ring finger as well as my middle finger and index finger to stabilize this blade so that we can control how much force is being applied. So I can put more force within my middle finger and ring finger that rest on the toe and then gradually apply more force to this scalpel, which is a chisel blade, and it'll slice along the nail plate. If you don't use this technique as you're pushing, you can haphazardly create a cut because the force is not going to be uniform and you may slip off the nail plate. So you're going to want to make sure that you have that technique employed when you're cutting the toenail. The next step is to then grab that toenail, and we use an instrument known as hemostats, which is basically like a pair of pliers that's going to clamp down on that toenail. After we clamp down on the toenail, we're removing the ingrown portion, and that's what you can see here. And then that glistening white structure at the bottom part that I'm pointing to here is the matrix, and that's the area that grows the toenail. And those cells are going to be ablated. So we've performed this small procedure first, and then we're going to introduce a chemical to actually get rid of those cells. I'm just confirming that we've cut back the whole way with that chisel blade, because if we don't and we leave a small portion of that remaining, it can become an inflammatory agent. And the patients will sometimes come back after the procedure and they're complaining that they have something remaining in there. They think that the toenail is actually growing back when it is actually a portion that was left behind. And so now we have a cotton-tipped applicator that's being inserted into this nail groove, and that has the chemical on it that's going to ablate these cells. And we do roughly 3 30-second applications. Now, some surgeons will do 2 45-minute applications. I tend to do around 3 30-second applications. And this is to ensure that we've created enough burn. Because if you don't burn it long enough, the cells can then reoccur. Now, some patients, it's a small percentage of patients, can't really give you a number offhand. I would say it's less than 1%, but there's a small portion of patients that don't respond to phenol. And what happens is you'll try to create this burn and it doesn't actually happen and the toenail can grow back, but it's extremely rare. When this happens, we then have to perform a procedure where we're excising the matrix, and we excise it and put stitches in. But it's more effective using the phenol because the phenol is actually better than our eyes because it can bleed out a little bit and it'll destroy some of the cells that even our eyes can't see that could be forming a toenail. So you can see as we're performing this, we want to make sure that we're under the cuticle area, which we refer to as the eponychium. And as we're burning it with that chemical, you're actually not burning it. It's just a chemical that's causing an ablation or a more of a chemical burn. So when the patient is recovering, they're going to see kind of inflamed tissue that they sometimes think is infected. And as the days and weeks advance, it gets worse, meaning it will become more burned before it starts to heal. And that is all to make sure that we get rid of that toenail. So then after we've used that chemical, the next step is to put an ointment on, and that's where we're using some bacitracin ointment here. I use a larger amount than I would want the patients to use after the procedure, and we just want to make sure that this creates a nice moist environment to not damage any of the healthy skin on the outside of the area. The next step is to apply a gauze bandage, and then you're going to see we're using a technique to apply uniform compression. So we're putting several 2x2 gauze pads down. We clamp them down with our fingers, wrap with the gauze, and then we keep alternating, and this keeps a nice uniform pressure when we're applying it so that we don't strangulate or put too much of a tension around that toe, which could cut off some of the blood flow. You don't want to forget to remove that tourniquet, and that's what you can see we're doing here. We're grabbing that tourniquet with a little loop that was placed on there by the manufacturer. We pull on that loop, the tourniquet pulls away from the toe, and then we snip it and it comes right off. After this gauze is applied, you can either tape it in place, but what I like to use is a material known as Coban. And Coban is a stretchy like bandage that adheres to itself, and it also has a mild compression component to it, and that'll keep the bandage from coming off. Now this stays on for 24 hours, and then after that the patient soaks it twice a day with warm water and Epsom salts, and they apply Neosporin and a Band-Aid, and this is a permanent fix to stop an ingrown toenail. If you have any questions about ingrown toenails, you can drop them in the comments section below, and please make sure to check out our channel for other fun and interesting surgical videos as well as educational videos on foot and ankle related injuries.